So let us straight away go to the multiple choice questions. We will be discussing multiple choice questions from different topics in psychiatry. And while explaining the answer, I'll also be discussing about certain other possible questions which can be asked related to this topic. So going straight to the first question. A 10th standard student who is preparing for his board exam is given a motivational speech daily evening by his father. The boy regards this experience as extremely unpleasant. One evening, when the father returns home, the mother tells him that the boy studied for 3 hours that day without she asking him to do so. Extremely happy with his son's behavior, the father decides not to give him the motivational speech that night. This is an example of. There are 4 options. Option A is passive punishment, B is active punishment, C is positive reinforcement, and D is negative reinforcement. Answer to this question is option D, that is negative reinforcement. So how do we arrive at this answer? So we shall explain 3 important theories which are related to parenting or child development or human behavior as such. These 3 theories include classical conditioning by Ivan Pavlov, operant conditioning by B.F. Skinner, and third one is social learning theory by Albert Bandura. So classical conditioning by Pavlov, it is familiar to all of you. It is the experiment, the famous experiment using dogs. So Pavlov, there was this dog which was put in a cage. Pavlov used to ring a bell and immediately after ringing the bell, present the dog with meat. This repeated several times. On seeing the meat, the dog used to start salivating. But after 5 or 6 attempts like that, in the 7th occasion, Pavlov rang the bell but did not present the meat to the dog. But despite not presenting meat, the dog started salivating. That is the reason for that is that the sound of the bell ringing was already paired with the image of the meat being distributed in the mind of the dog. And so just when the bell sound was heard, the dog anticipated the arrival of the meat and salivated in anticipation. So this is classical conditioning. So we have got an unconditioned stimulus and a conditioned stimulus. Unconditioned stimulus is presentation of the meat and the response to it is salivation. Conditioned stimulus is ringing of the bell. And when the conditioned stimulus is paired with the unconditioned stimulus of supply of the meat repeatedly several times, the same response which the unconditioned stimulus presents or elicits in the dog is elicited when the conditioned stimulus of ringing the bell is also presented. That is classical conditioning for you. Second is operant conditioning. Operant conditioning was introduced by B.F. Skinner. These names may also be sometimes asked as MCQs. So in operant conditioning, there are 4 important things: positive reinforcement, negative reinforcement, passive punishment, and active punishment. Reinforcement is an intervention which is done in order to increase the frequency of a desirable behavior. When the child is behaving well, to increase the frequency of that kind of behavior, we do reinforcement. And punishment is an intervention which is done to reduce the frequency of an undesirable behavior. If a child is not behaving properly, we punish the child to reduce the frequency of that behavior. Again, what is meant by positive reinforcement? Positive reinforcement is when a child is showing a positive behavior, an acceptable behavior, then we reward the child so that that behavior can be repeated or increased in frequency. For example, if the child is studying for 2 hours continuously, you gift the child with a chocolate. So that is what positive reinforcement. This positive reinforcement can happen in 3 different ways. First is material reward. Material reward means you gift the child by giving him some material objects, like handing over a chocolate if the child has studied well, buying him a laptop if he has scored first rank in the examination, something like that. Then we have got emotional reward. Emotional reward means displaying affection to the child, hugging him, kissing him, and telling the child how much you love him, consequent to demonstration of a positive behavior. The child is studying well for 3 or 4 hours continuously. You hug or kiss the child and tell him that how much you love him. That is emotional reward. Then we have got social reward. Social reward means if a child has done something responsibly, we appreciate the child in front of others. We congratulate the child in front of our neighbors or relatives, and that is social reward. These are the 3 types of positive reinforcement. Then negative reinforcement. The answer to this question is negative reinforcement. Why I put this question is because negative reinforcement is taught in a wrong way in several places. So negative reinforcement means when a child or a person is demonstrating an acceptable positive behavior, you take away an unpleasant stimulus which is given daily to the child or to that person. The classical example is given in this question itself. The child is studying for the 10th standard board exams. The father thinks that it is important to motivate the child in the evening. So the father comes, talks to the child, and gives a motivational speech about how he studied under the light of the lantern and got first class in the SSLC examination, or how he had to face so many hardships in life to make it big. So the father thinks that it is in fact a motivational speech, but the boy regards this as the most unacceptable, unpleasant thing in the world. So one day evening, when the father is coming home, the mother is telling the father that our son, even without me asking him to study, he studied for 3 hours continuously. I did not tell him to study, but he responsibly studied. So what is the father doing? Very happy with the son's performance. He is taking away the unpleasant experience. He decides not to do the motivational speech, which is in fact an unpleasant thing for the child. So what will the child learn from that experience? Next day onwards, even before the mother asks him to study, he'll start studying to avoid the motivational speech of the father. So that translates into a positive behavior. And this is called negative reinforcement. So I hope why the correct answer is D to this question is very clear to you. Now we come to punishment also. Punishment, as I have already mentioned, is an intervention which is done to reduce the frequency of an unacceptable, undesirable behavior. So passive punishment means you are withdrawing a privilege. The child is enjoying a particular privilege every day, but when the child is showing unacceptable behavior, you are withdrawing that privilege. For example, you ask the child that if you study for 2 hours every day, I'll give you the mobile for 1 hour after that. You can play games in the mobile for 1 hour. One evening, the child refuses to study. He is showing tantrums and he says that, I will not study, however hard you try. In such a situation, you tell the child very calmly, since you are not studying today, you will not be given the mobile today. You will not be allowed to play games in the mobile. This is passive punishment. You are withdrawing the privilege the child is enjoying. And active punishment is what is happening in our households every day, beating the child, abusing the child, hitting the child, making fun of the child. When the child is not, doing things properly, telling the child that I'll make fun of you, scolding the child. That is active punishment. Active punishment should be the last resort. It should not be the first resort. So this is operant conditioning. And then third is social learning theory. I'll explain that also in brief because questions from that also can come. Social learning theory was introduced by Albert Bandura, Albert-Bandura. Albert Bandura expired very recently. Albert Bandura's social learning theory says that children observe adult behavior. They keenly observe the behavior of adults and they internalize, imitate and impersonate adult behavior. So if father and mother are always fighting and using abusive words, the child will observe that behavior, internalize that kind of behavior and go and use such abusive words with his friends at school. So that is what is called social learning theory. So in child development, it is very important to behave yourself in front of the child. Don't use abusive language in front of the child. Don't use alcohol or drugs of abuse in front of the child. And don't physically fight in front of the child. That is social learning theory. Now we come to the next question. Hope the question is visible to you. A 75-year-old gentleman wakes up one morning with severe headache, which is followed by projectile vomiting.
Sir, കുറച്ചുകൂടെ ചെറുതാക്കോ സ്ക്രീൻ സാറേ ആ ക്വസ്റ്റ്യൻ മുഴുവനായിട്ട് അത് മതി.
Is this okay?
Yes.
75-year-old man wakes up one morning with severe headache, followed by projectile vomiting and confused behavior after that. There is no history of head injury in the recent past, but there is a history of slip and fall in the bathroom 3 months back, followed by which he did not have any significant health issues at that point of time. What is the most probable diagnosis? Here, there is no recent head injury. Usually, as we all know, a question can come from surgery or radio diagnosis regarding which of the following is an indicator to take CT scan following head injury. So some of the indicators which say that CT scan should be taken as an emergency is severe headache, which is intractable, vomiting, bleeding from nose or ears or something like that, and seizures. So if any of these 4 things are present, CT scan should be taken immediately. But there was no history of head injury in this 75-year-old man recently. However, about 3 months back, this gentleman had slipped and fell down in his bathroom. There was a small trivial trauma to the head, but it did not produce any intractable headache or seizures or vomiting or bleeding. So nobody bothered to take the CT also. So the most probable diagnosis is choice A, subarachnoid hemorrhage, choice B, normal pressure hydrocephalus, normal C, chronic subdural hematoma, and choice D, migraine. So the answer to this question is choice C, chronic subdural hematoma. So if you have a trivial trauma to the head, a very small fall or very small hit on the head, when you are young, it need not produce much of a problem. But in your old age, even this very trivial trauma can lead to rupture of small blood vessels, leading to accumulation of blood in the subdural area. So it need not lead to manifestation of symptoms immediately. Slowly over several days, several weeks, this blood can get organized into a clot in the subdural region, and it starts exerting pressure on the brain tissue. And the increased intracranial pressure, which is produced as a result of the pressure on the brain tissue, will manifest in the form of vomiting, headache, and confused behavior. So that is chronic subdural hematoma. So how this person should be managed, that also can be a question. So in such a situation, the person has to be subjected to an emergency CT scan of the brain. And if the chronic subdural hematoma is identified, it should be subjected to a burr hole evacuation. The neurosurgeon will evacuate the hematoma and all the symptoms are solved. So what are the other choices also? Questions can come regarding the other choices. The second choice, option B, normal pressure hydrocephalus. This can also be an MCQ for you. Normal pressure hydrocephalus is a condition in which there is no increase in intracranial pressure, but there is accumulation of cerebrospinal fluid in the cerebral ventricles, leading to dilatation of ventricles without increasing intracranial pressure. So what are the clinical features of normal pressure hydrocephalus? The clinical feature of normal pressure hydrocephalus is a triad of symptoms, and this triad is, first one is urinary incontinence, second is dementia, and third is ataxia. So urinary incontinence, dementia, and ataxia, that is the triad of normal pressure hydrocephalus. So an elderly person is brought to you, he is unable to walk, that is ataxia. He is smelling of urine because he is having incontinence, and the relatives say that this fellow does not remember anything, that is dementia. So the triad of these 3 symptoms, urinary incontinence, dementia, and ataxia. In such a situation, again, we have to subject the person to an imaging, and in imaging, CT or MRI, whatever it is, you can see the dilatation of the cerebral ventricles due to accumulation of CSF, but since there is no increase in intracranial pressure, it does not lead to a headache of sorts. That's it. So what is the treatment of normal pressure hydrocephalus? That can also be an MCQ question for you. The treatment of NPH, normal pressure hydrocephalus, is ventriculoperitoneal shunting. It's a surgical procedure by which a shunt is connected from the ventricles to the peritoneum, which will ensure that the excess CSF is drained from the ventricles to the peritoneum and is excreted. And for the medical management of the same condition, sometimes you may resort to drugs like acetazolamide, which is a carbonic anhydrase inhibitor. So if a question comes regarding what is the drug of choice for normal pressure hydrocatalysis or something like that, acetazolamide, which is a carbonic anhydrase inhibitor, can be that. And migraine, the fourth question, migraine can also be an MCQ for you. Vascular headache or migraine, it can present with headache and vomiting, as we all know. But most often, this headache and vomiting in migraine usually occurs during daytime. The triggers or precipitants of migraine usually are sleep disturbance, stress, direct exposure to bright sunlight, or direct exposure to any other form of bright light, consumption of chocolates, ice creams, etc. So these are the triggers of migraine. If you have not slept at night, if you are exposed to too much of sunlight or bright light from the television or from the mobile or from your laptop, if you have consumed chocolate, ice cream, etc., you are going through severe stress, all these can lead to migraine. So migraine can present with severe throbbing headache on one side of the head, which is associated with photophobia and phonophobia, intolerance to sound and intolerance to light, and nausea and sometimes vomiting. Often the headache of migraine is relieved by vomiting. It is relieved by sleep also. It occurs only during daytime. At night, it does not happen. It is relieved by sleep. These are the characteristics of migraine. What is the drug of choice of migraine can be a question. Triptans. Triptans are the drug of choice of migraine. Sumatriptan, rizatriptan, naratriptan, so many triptans, which act on the 5-HT3 receptors, the serotonergic receptors. They are the drug of choice. And there can be another question regarding the prophylactic drugs in migraine. Prophylactic drugs or interval drugs. They are the drugs which are given to people with migraine to prevent the recurrence of migraine. Once an acute episode of migraine is settled down, there is a possibility that migraine may recur again. So the drugs which are given to prevent the recurrence of migraine, they are called prophylactic drugs or interval drugs. It is good to remember the name of some of these drugs, because which one of the following medicine is not given as a prophylactic drug for migraine? Which one of the following drugs is not used as an interval drug for migraine? That question can come. Usual drugs which are used include tricyclic antidepressants like imipramine, amitriptyline, nortriptyline, etc. Anti-epileptics like divalproic sodium, carbamazepine, gabapentin, pregabalin, oxcarbazepine, and topiramate. It can be calcium channel blockers. It can be beta blockers like propranolol. Whole lot of these drugs. It can be drugs like flunarizine. So these are all interval drugs or prophylactic drugs given for migraine. Sometimes a question can come regarding the drug of choice in resistant migraine as prophylaxis. So resistant migraine means migraine which keeps on coming even after giving almost all of these prophylactic drugs. The drug of choice for resistant migraine as prophylaxis is topiramate. Topiramate is an anti-epileptic. It was discovered as an anti-epileptic, but nowadays topiramate has so many other indications. It is used in migraine. It is used to reduce appetite in obesity. It is used as an anti-craving drug for alcohol-dependent people. So all these are the different uses of topiramate. So such a question can also come. So that is regarding migraine. So there are some other types of vascular headache also about which questions can come. And one another common area is cluster headache. Cluster headache is also very similar to migraine, in the sense that it can also happen as unilateral headache. But the difference from migraine is that cluster headache is often associated with lacrimation and rhinorrhea. It can happen at night when the person is asleep. The person can be woken up from sleep because of cluster headache. And the types of headache which can happen at night, that also you have to be careful about. Such questions can come. So cluster headache and any other cause of headache, which may be due to increased intracranial pressure, can happen at night, like subdural hematoma or even a tumor which is leading to headache. All these things, or cerebral hemorrhage, hypertension leading to cerebral hemorrhage. All these can lead to headache from which the person may be woken up at night from sleep. But migraine usually does not happen at sleep. So that is the answer to the question. So the answer to the question is choice C, chronic subdural hematoma. Now we come to the next question. Which one of the following is not a mature ego defense mechanism? Choice A, sublimation. Choice B, undoing. Choice C, anticipation. And choice D is humor. So what is meant by ego defense mechanisms? Ego defense mechanisms can be simply defined as unconscious reactions to frustration. Unconscious reactions to frustration, the way in which our mind is trying to adapt to difficult situations or new situations, and the subconscious responses, that they are called ego defense mechanisms. So there are different ego defense mechanisms. Some of those defense mechanisms are called immature defense mechanisms. Some are neurotic, some are psychotic. The whole list is there. But most often, question is regarding mature ego defense mechanisms. Mature ego defense mechanisms are those mechanisms which help a person to survive positively, while immature, neurotic, and psychotic mechanisms often create problems in life. Some of those defense mechanisms can be the basis of even psychiatric illnesses. But mature defense mechanisms help a person survive. So this concept of ego defense mechanisms, it was introduced by Anna Freud, who is the daughter of Sigmund Freud. So among these things, undoing, choice number B, it is not a mature defense mechanism. So the answer to this question is B, that is undoing. Undoing is a defense mechanism which is seen in illnesses like obsessive compulsive disorders. So I shall explain what are the mature defense mechanisms with some examples for you to understand. The common mature defense mechanisms include sublimation, suppression, anticipation, humor, altruism, and asceticism. So these are the different defense mechanisms. So this classification of defense mechanisms into 4 categories, it was introduced by a person called George Eman Wayland. George Eman, E-M-A-N, V-A-I-L-L-A-N-T. He was a person who introduced the classification of defense mechanisms into 4 categories. So Wayland's classification of defense mechanisms, level 1, that is pathological defense mechanisms, which can be psychotic defense mechanisms. Most of these defense mechanisms can be the basis of psychotic illnesses like delusional disorders, schizophrenia, etc. Level 2, they are called immature defense mechanisms. Immature defense mechanisms are, defense mechanisms which are seen in people with immature states of mind, so-called fantasy, projection, acting out, passive aggression. All these are examples of immature defense mechanisms. Level 3 is neurotic defense mechanisms. Neurotic defense mechanisms are defense mechanisms which can be responsible for some of the neurotic disorders like anxiety disorders, depression, obsessive compulsive disorder, etc. Examples include intellectualization, reaction formation, dissociation, displacement, repression, all these things. And the 4th level, level 4, is mature defense mechanisms. So we shall understand what are the mature defense mechanisms, because describing all the defense mechanisms here may be out of scope of today's class, because I'm supposed to finish in a short time and we have another class tonight also. I'll explain the meaning of the mature defense mechanisms. Mature defense mechanisms, first one is sublimation. Sublimation is you are transforming a dangerous thought process or an unhelpful thought process or instinct into a healthy action. For example, you see a very beautiful lady in your neighborhood and you feel sexually aroused. There is a tendency that you may approach that lady inappropriately. Instead of doing that, you start painting a beautiful picture. and your sexual drive is getting converted to an artistic performance. So this is what is called sublimation. So something which was unacceptable, something which should have landed you in trouble, is getting converted into something which you can bring you recognition. Because if you paint a beautiful picture, it can make you famous, it can add on to your life. So that is sublimation. Second mature defense mechanism is suppression. SUPPRESSION. Suppression means it's a conscious decision made by a person to delay giving attention to a particular thought or emotion or need in order to cope up with the realities of your life. You know, you are going through a very difficult phase of life. You are going for an examination. If you pass this examination, you can get a job and you can become financially stable. So while walking through the road, you see the advertisement of a bar or advertisement of alcohol or something. You have an inclination, you have a strong inclination to go to the bar and have some alcohol and have some good time. But if you go and drink alcohol, sure that you may miss this chance to get a job, and that can land you in trouble in life. So what you decide is, decide to ignore that impulse to have alcohol, consciously may take a decision not to give attention to your desire to use alcohol, and you walk straight, you go to the place of your interview, give the interview and get the job. That is what is called suppression. Conscious decision to push down unacceptable impulses in your mind. Third is anticipation. Anticipation means you are expecting the consequence of an action very realistically. That is, when you plan to do something, you may have an idea, especially, most of you are going to attempt the NEET examination. So there are two outcomes which are possible. The first outcome is you may get through NEET, you may become a postgraduate, you may join for the post-graduation course this year itself. That's one possible. Second possibility is that you may not get a very good score in the NEET exam, and you may not get into a postgraduate course this time. So realistically thinking about the two possibilities and conditioning your mind to accept either of those possibilities is anticipation. If you don't have anticipation, what happens is you will dream a lot, you will think only about successful outcomes for your action. And if due to any reason your action does not become successful, you run into trouble. That is anticipation. Then humor. Humor is the art of laughing at yourself. So actually, humor is a very positive defense mechanism which is used by public speakers. When you do a public speech, it is always good to begin the public speech by describing a self-goal, something which happened to you, which landed you in trouble, something like that. Some mistake which happened in your life, which made everyone laugh. So if you can laugh at yourself and laugh at yourself along with others, that's a very positive way of managing things. If you start laughing at yourself, even if somebody else makes fun of you, it will not touch you. Criticisms, by others, rebuking or making fun of by others will not touch you. That is humor. And the other two positive defense mechanisms, first is altruism. Altruism means it's a constructive service to others, which gives you a sense of personal satisfaction. You don't get any material benefit out of it, but you do a service as a result of which somebody else is benefiting. You are not benefiting, somebody else is getting a concrete benefit. But the fact that your action was able to bring a benefit to somebody else gives you a sense of well-being, sense of happiness, sense of pleasure. That is altruism. So contributing some money to the educational needs of a student who is from a deprived background, or donating blood to a person who has met with an accident, all these can be examples of altruism. And asceticism is the last one. ASCETICISM. Asceticism. Ascetic means a person who has renounced everything. He's a saint or a sage. He's not into material comforts. He considers everything as equal. So asceticism is such a state of mind in which you're no longer lured by any of the material comforts of the present world. You're not at all motivated by what somebody else has achieved in life. You consider, achievements and failures with an equal state of mind. You're not bothered by anything at all in his life. Nirmamo nirahangara samadukha sukha. That is what they say in Sanskrit. So that is what is called ascetists. So these are the mature defense mechanisms. So regarding the immature defense mechanisms and some other things, I think I have added a couple of questions in the note. I had prepared a list of around 300 MCQs. It was already handed over to you, I suppose. There are some questions in that also. You can find some of them there. Now coming to the fourth question. Which one of the following is not among Goldstein's triad in dementia? Choice A, persecutory delusion. Choice B, organic orderliness. Choice C, catastrophic reaction. And choice D, shrinkage of meaning. Answer is choice A, persecutory delusion. It is not a component of Goldstein's triad. So let me explain what is meant by Goldstein's triad. Goldstein, Kurt Goldstein, his full name. This was a German psychiatrist. He described 3 behavioral symptoms which are commonly seen in people with dementia. And the 3 behavioral symptoms described by Goldstein include: number 1, organic orderliness; number 2, catastrophic reaction; and number 3, shrinkage of milieu. I'll explain each of these terms in a little bit detail. What is meant by organic orderliness? Organic orderliness means, when you're a small kid or you're studying in lower classes, in lower primary schools or something like that, if you're supposed to write an exam, you're supposed to learn a chapter from the first sentence to last sentence completely. If questions and answers are given to you, you are supposed to learn everything completely. Only if you perfectly read and learn everything, then only you will be able to perform well in the exam. But what happened to you when you came to medical college? What was the type of learning when you came to medical college? I'm sure none of you would have perfectly read any book in medicine during your undergraduate days. So what happens there is that you read something from there, something from here. You may listen to some lectures by your teachers, you may listen to the combined study material which is given by some of your roommates in hostel, and a little bit of your imagination and creativity also. You will bridge all these available information, and using your creativity, you will, create an answer. And some of these answers will have good factual content, and some other answers will have limited factual content and more of creative material. So that is supposed to be an advanced brain function. But by the time you become old, when you are above 60, you become demented. When you develop dementia, you regress to your childhood state. If you're reading something, you need to read it completely from the first to last sentence to understand it. While you're reading the newspaper, if a dog is barking aloud, your attention is distracted, you look towards the dog, and after that, the continuity of what you have read is lost. That is organic orderliness. You can remember things only in a particular meticulous order. If you don't maintain that order very correctly, you tend to forget things. That is organic orderliness for you. Second is catastrophic reaction. Catastrophic reaction is sudden anger outburst, sudden explosive outbursts, which are shown by people with dementia. Especially if you have a demented person at house, most of the relatives have this habit of checking his memory intermittently. When a neighbor is coming or a relative is visiting, you will ask the demented person, do you know who this is? And if the person notes in acknowledgement, then you will ask the next person, then please tell me his name. If you know his name, please tell me his name. In the initial phase of dementia, you go through something called anomia, A-N-O-M-I-A. Anomia means inability to recall the name of commonly used objects as well as the name of some people, especially people who you are not interacting with on a day-to-day basis. So some neighbors with whom you don't interact every day, or a relative who visits you once in a year, you may not be able to recall the name instantaneously. So you know the person, you know that you are very closely related to the person, but you cannot get the name. So exactly at that time, if the relative provokes this demented person by prodding him repeatedly, forcefully to tell the name of the visitor, then instead of telling the name, he may suddenly show anger outbursts. And this anger outburst is not a display of hatred towards anybody, It is an expression of subconscious frustration. It's a reaction of a helpless mind, When you know that you cannot recall the name, it comes out, that helplessness comes out as an anger outburst. That is catastrophic reaction. And shrinkage of milieu, M-I-L-I-U, milieu means environment of activity. Shrinkage of milieu means this person who was very socially active with a lot of friends who used to go out on holidays, engaging in various social, political, cultural activities. When he becomes demented, he becomes afraid of going out because he fears that he may lose his way. So what he does is, he wants somebody else to accompany him whenever he goes out. And after a certain stage, he does not go out even when there is somebody along with him. He prefers to remain at home. And after a certain stage, he does not even give face to visitors. He confines himself to his own room and gradually becomes bedridden or wheelchair bound. So that is the gradual, shrinkage of the social sphere of activity. That is what is called shrinkage of milieu. There can be some questions from dementia also. Some of the questions I have already given in the notes which I have given to you. But some common questions can be, number one, the commonest type of dementia. Commonest cause of dementia is Alzheimer's disease or senile dementia of the Alzheimer's type. The prevalence of dementia in our population, above 65 years of age, 5% of the population have got dementia. And there can be questions like, what is, Ribot's law of memory regression? R-I-B-O-T apostrophe S, Ribot's law of memory regression. Ribot's law of memory regression means things learned in the immediate past are forgotten early, while things learned in the distant past are remembered for a longer period of time. So when you are young, when your brain is completely active, all the three aspects of memory, registration of new information, storage of registered information, and recall of stored information, everything is perfect. But later in life, when you become demented, the first function which is lost is registration of new information. You are unable to register new information, but what is already registered in your childhood, you don't have any difficulty in recalling. That is why you remember the poems you have studied in 10th standard, but you forget the fact that you were given breakfast in the morning. Because even when you have breakfast, the fact that you are eating breakfast is not registered in your brain. So maybe after half an hour, you'll come and demand breakfast again. When the relatives say that you have been given breakfast, you tell them that you have not been given breakfast, and then a fight happens. This is Ribot's law of memory regression. That can also be an MCQ. Then another MCQ can be about, treatable causes of dementia. Which one of the following is not a treatable cause of dementia? Hypothyroidism, alcoholism, vitamin D deficiency, depression. All these are treatable causes which can lead to cognitive impairment. You don't call them as dementias, actually, call them as pseudo-dementia. The difference between pseudo-dementia and dementia is, in pseudo-dementia, the patient will be complaining that I don't remember anything. But in real dementia, patient does not complain anything. The relatives complain that the patient forgets things. That's the difference between dementia and pseudo-dementia. Again, there can be questions regarding the drug of choice in dementia. Usually, the neurobiology of dementia is depletion of acetylcholine. So, cholinergic neurons are degenerated. So, the level of acetylcholine comes down in the brain. That is one of the important correlates of dementia. So, the drug of choice of dementia will be drugs which increase the level of acetylcholine. You call them as cholinesterase inhibitors. So acetylcholine is acted upon by an enzyme called cholinesterase, and it is split off. So drugs which inhibit this cholinesterase enzyme, that can lead to increase in the level of acetylcholine in the brain. And some of the examples of cholinesterase inhibitors include tacrine, T-A-C-R-I-N-E, donepezil, D-O-N-E-P-E-Z-I-L, rivastigmine, R-I-V-A-S-T-I-G-M-I-N-E. Remember, it is rivastigmine and not physostigmine, neostigmine, or pyridostigmine. These three stigmines which I mentioned right now, they are used for the treatment of myasthenia gravis. Physostigmine, neostigmine, and pyridostigmine, they are used for the treatment of myasthenia gravis, which is a neuromuscular junction abnormality. While rivastigmine, R-I-V-A-S-T-I-G-I-N-E, Rivastigmine is used for the treatment of dementia. Don't confuse these names. And the fourth one is galantamine, Gallantamine. So tacrin, donepezil, rivastigmine, and galantamine are the cholinesterase inhibitors. Out of these four drugs, tacrin is banned now because tacrin produce significant liver toxicity. So now it is banned in all countries. Even it is not available in our part of the world. The other three drugs are available. So for the treatment of mild to moderate dementia, you can give these three drugs. But for severe dementia, what is the drug of choice for severe dementia? Drug of choice for severe dementia is memantine, memantine. Memantine is a glutamate antagonist. You know, there can be questions regarding glutamate also. It's glutamate, GABA, all these neurotransmitters, they are questions from the basic sciences. But since I've touched upon that, I'll just mention a couple of MCQs from that also. Which one of the following is not a glutamate receptor? The question can come. So there are two types of glutamate receptors, ionotropic receptors and metabotropic receptors. Metabotropic receptors are GLUT1, GLUT2, GLUT3. They are not very significant from the MCQ point of view. But ionotropic receptors, there are three ionotropic receptors which you need to remember, because which one of the following is not an ionotropic glutamate receptor can be an MCQ from physiology or pharmacology. So the examples for the ionotropic glutamate receptors, number one is NMDA, N-methyl D-aspartate receptor, NMDA receptor. Second is AMPA receptors, and third is kainate, Kainate. So NMDA, AMPA, and kainate, these are the three ionotropic glutamate receptors. Out of this, NMDA is clinically the most important receptor, N-methyl D-aspartate receptor. So drugs which are antagonists at the NMDA receptor, they are used in different branches of medicine. For example, the drug which is used in anesthesia called ketamine. Ketamine is a popular question for MCQ. Two questions can be asked about ketamine. Number one is the fact that ketamine produces dissociative anesthesia. Which one of the following anesthetic agents produce dissociative anesthesia? Answer is ketamine. And the second question about ketamine is regarding the mechanism of action of ketamine. Ketamine is an NMDA antagonist. We were speaking about memantine right now. Memantine, the drug of choice in severe dementia. It is also an NMDA antagonist. We have another NMDA antagonist which is used in the treatment of Parkinsonism these days. It was discovered as an antiviral drug. In your pharmacology textbooks, you can read about this drug as an antiviral drug. But later, serendipitously, it was identified as a drug which was useful for Parkinson's, because it was given as an antiviral to different people. But when elderly people with Parkinsonism received this drug, their tremor subsided, their rigidity improved. That is how it became a drug for Parkinsonism. The name of the drug is amantadine, which is given for Parkinsonism. That is also an NMDA antagonist. And another NMDA antagonist which is very popularly used is acamprosate, ACAMPROSATE. Acamprosate is given for alcohol de-addiction. It is an anti-craving drug for alcoholism. It reduces the craving for alcoholism. So these are some of the NMDA antagonists. So just mentioning some of the related areas also when I was just mentioning about this. So these are the answers to the questions. I think I'm taking a lot of time, so I'll be moving a little bit fast. So this is again a question from psychology regarding, the concept of complex. The concept of complex was introduced by which of the following people? Choice A is Alfred Adler, choice B is Erik Erikson, choice Sigmund Freud, and choice D is Carl Jung. The answer to this question is choice D, Carl Jung. Carl Gustav Jung, as you call him, CARL GUSTAV JUNG. JUNG is the spelling, but the J is silent. You pronounce him as Jung. So Carl Jung was the person who introduced the concept of complexes and things like that. So later, inferiority complex, such a concept was introduced. Alfred Adler was the person who introduced the idea of inferiority complex. If the question is about inferiority complex, then the person who introduced it is Alfred Adler. Then Erik Erikson is another person who mentioned about the different stages of life. 8 stages of life in human being, trust versus mistrust, autonomy versus shame. So he had described that human life goes through 8 different stages. Erik Erikson was the person who proposed that. So for want of time, I am not describing the theoretical aspects of most of these things, but just mention that if the question is coming that which one of the following describe the 8 stages of human life cycle, then Erik Erikson. Erik Erikson is also credited with another very landmark work. He was a person who wrote the biography of Gandhi. Even though he was a Western psychologist, very influenced by Gandhi, and he has analyzed the personality of Mahatma Gandhi and Martin Luther King. So Martin Luther King and Mahatma Gandhi have a lot of things in common. Both of them use similar strategies to ensure the upbringing of the marginalized sections of society. So Erik Erikson is one person who have analyzed the personality of both Gandhiji and Martin Luther King and had written books on that. And Sigmund Freud is the father of psychoanalysis, as you call it, psychoanalysis. So Freud's concepts include the theories of ego, id, and superego at one end, then classification of mind into 3 categories: conscious, subconscious, unconscious, mind, etc. So all these are the contributions of Sigmund Freud. And Carl Jung, another question about Carl Jung can come is, Carl Jung introduced a concept called analytical psychology. Analytical psychology. The founder of analytical psychology is Carl Jung, while the founder of psychoanalysis is Sigmund Freud. So these are also MCQs which may be asked about. Coming to the 6th question, going a little bit fast since we are supposed to finish at 5:30. A sexual paraphilic disorder, pardon the spelling mistake, it is not parabolic, it is paraphilic. Sexual paraphilic disorder in which a person derives sexual gratification by inflicting pain on the sexual partner is choice A, sexual masochism, choice B, sexual sadism, choice C is fetishism, and 4 is frotteurism. The answer to this question is choice B, sexual sadism. So again, sadism is a term which is very commonly used in conversation. The origin of the word sadism can also be sometimes asked as an MCQ. Actually, the term sadism comes from literature, not from psychology. There was this very famous writer called Marquis de Sade, Marquesdesade. Marquis de Sade wrote a lot of creative literature, novels and stories in which, the protagonists in his novels used to engage in very violent sexual activities. Activities including suffocating the partner, hitting the partner, inflicting pain on the partner, and experiencing pleasure. So that is from his novels. It is from there that the term sadism came to our common knowledge, and it is now being used. So that can also be sometimes an MCQ. So a list of sexual paraphilic disorders. Sexual paraphilic disorders means disorders in which a person is having sexual arousal to unusual stimuli. That is called paraphilic disorders. There are a list of 8 paraphilic disorders, out of which 4 of them are mentioned here. I'll explain the meaning of these and then describe the other 4 also. Any of these can be asked as an MCQ. Sexual masochism. Masochism is the opposite of sadism. So in masochism, you get sexual pleasure when somebody is inflicting pain on you. When your sexual partner is inflicting pain on you, you get pleasure out of it. That is masochism. While sadism is just the opposite. You inflict pain on your partner, and when you see your partner in pain, you get pleasure. Fetishism. Fetishism means the sexual arousal at unusual body parts or inanimate objects. Unusual body parts means usually for a human being, there are certain parts of the body which may produce sexual arousal, like genitals or breast or such areas. But sexual arousal on seeing the nails of a person or sexual arousal on seeing the foot of a person is very unusual. So that is fetishism. And sexual arousal on seeing the undergarments or handkerchief or the footwear or a bag, all these are very unlikely to produce sexual arousal, but repeated arousal on seeing that. That is called fetishism. Frotteurism, the fourth one, Frouetteris. Frotteurism is the kind of issues which happen in crowded places. So getting sexual pleasure by rubbing your genitals against the body of an unsuspecting person. That is frotteurism. It happens in crowded places, etc. Then the fifth one, which is not given in this list, pedophilic disorder. Pedophilic disorder means sexual arousal exclusively towards children who are developmentally immature. Children who are less than 12 years of age, to be specific. That is pedophilic disorder. Then we have got voyeuristic disorder. VOYEURISTIC. So voyeuristic disorder means you get sexual pleasure by secretly watching another person disrobing, changing clothes, or remaining nude, or having sex with another person, getting sexual arousal out of that. That is what is known as voyeuristic disorder. And then we have got transvestic disorder. Transvestic disorder means you get sexual pleasure by wearing the garments of people belonging to the opposite gender. So you are a male, but by wearing female garments, you get sexual pleasure. As a female, you get pleasure by wearing the garments of a male. And you have to compare and contrast it with transgender. Transgender and transvestism are not exactly the same. They are different. With transgender, or what you call sexual gender identity disorder, as you call it. So, or gender dysphoria, as you call it. In that situation, a person has difficulty in identifying himself as a member of his biological gender. He identifies himself as a member of the opposite gender. So because of that, he may wear the clothes of the opposite gender to complete his identification with the opposite gender. So that is what is called transgender or gender dysphoria. But in transvestism, the person does not want to become a member of the opposite gender or anything. He doesn't want a gender change or anything, but he gets sexual pleasure only by wearing the clothes of the opposite gender. That is transvestism. So these are the sexual paraphilic disorders. A question can come from that. Next is a 12-year-old child presents with sudden onset abnormal behavior and making abnormal sounds, including obscene words and repetitive washing of his hands, following an episode of respiratory infection. His ASO titer is above 200, not about 200. What is the probable diagnosis? Choice A, Tourette syndrome. Choice B, complex partial seizures. Choice C, unspecified tic disorder. And choice D, PANDAS. The answer to this question is choice D, PANDAS. What is PANDAS? Full form of PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcus. Pediatric autoimmune neuropsychiatric disorder associated with streptococcus. That is the full form of PANDAS. So in PANDAS, what happens is a child who is well-behaved, normal, without any problems, he develops a respiratory infection or a skin infection due to streptococcus. It is treated, he recovers from that, and after recovery from that, he develops sudden onset abnormal behavior, abnormal movement, abnormal sounds. Abnormal behavior can include sudden anger outburst, violent behavior, head banging, etc. It can include repetitive washing, like compulsive washing, as in OCD. It can include peculiar kinds of movements of the head or the neck, as in tics, or creating some vocal tics, like obscene words or throat clearing or things like that. So here, there is a history of respiratory or skin infection with streptococcus. And we know that streptococcal infection is very notorious to produce systemic impacts. It can produce glomerulonephritis, it can produce rheumatic heart disease. Just like that, the streptococcal remnants can go to the brain and produce irritation in the basal ganglia, and that leads to pandas. The clinical features of pandas include violent behaviors or hyperactive behaviors, tics. Tics can be either vocal tics or motor tics, and obsessional behaviors or obsessive compulsive behaviors like repeated washing or saying the same word over and over again or doing the same action over and over again. So in pandas, when we check the ASO titer, it is likely to be pretty high. So that is pandas. So the treatment for the behavioral problems have to be given with anti-obsessional agents and agents to reduce the tics. Along with that, it is also postulated that treating the ASO titer with oral penicillin also helps. So what are the other options given here? Tourette's disorder, the first choice A. Gilla-Dilla Tourette syndrome, specifically, that is the full terminology. So in Tourette syndrome, it's a condition in which at least 2 motor tics and at least 1 vocal tic occurs in the life of a person, need not be at the same time. So tic, it's a sudden abnormal movement which occurs due to contraction of one group of muscles or multiple related groups of muscles. So tics can be motor tics or vocal tics. Motor tics means they are abnormal movements. It can be simple motor tics by like frowning or lip smacking or showing faces or just shrugging of the shoulders, etc. All these are simple motor tics. Complex motor tics can involve multiple groups of muscles. So getting up and sitting down repeatedly, it can be a complex motor tic. And vocal tics are abnormal sounds which are created due to contraction of muscles in the larynx. So simple vocal tic include throat clearing, grunting, barking, creating such abnormal voices like howling, etc. Well, complex vocal tics include using abnormal phrases, abusive words, etc. repeatedly. So in Tourette syndrome, the person should have a history of at least 2 motor tics and at least 1 vocal tic in his lifetime. And all these tics need not be concurrently present. It can occur at different points. Then complex partial seizure also can present with abnormal behavior. But the difference is that in tics or in pandas or in Tourette's, the person is aware that he is showing an abnormal behavior or abnormal sound. But in complex partial seizure, short-lasting abnormal behaviors or abnormal sounds, but the person is totally unaware of the fact that he is showing such kind of behavior. We call it as automatism. So that is regarding complex partial seizure. So here, an MCQ regarding what is the drug of choice in different kinds of seizures can also be asked. For partial seizures, carbamazepine spectrum is the drug of choice. But generalized seizures, we say valproate and such drugs are there. But if you go through the latest issue of Harrison, a simple advice to you is, if you have time, just take the soft copy of Harrison and just read the charts which are given in Harrison. You don't have the time to read the entire theoretical material, but just read all the charts which are given in Harrison. You'll get a lot of MCQs based on those charts from different subjects. Harrison contains not only internal medicine, it contains a whole lot of other things. So just go through each of the chart and that can help you get a lot of answers also. So the chart about the drug of choice of different seizures in Harrison, if you go through that chart, there is only one drug which can be given as the first line treatment for all seizures, irrespective of the semiology, whether it is partial seizures, whether it is absent seizures, whether it is generalized seizures or myoclonic seizures. So all of them, lamotrigine is supposed to be the drug which is given, which can be given for all times. And lamotrigine, another MCQ can be asked about lamotrigine. Lamotrigine is the drug of choice for a pediatric condition called Lennox-Gastaut syndrome. Lennox-Gastaut syndrome. So Lennox-Gastaut syndrome is a child is presenting with severe mental retardation. He has severe self-injurious behavior and he has multiple seizure types. The same child is suffering from multiple different kinds of seizures, generalized seizures, complex partial seizures, myoclonic seizures, absent seizures. The drug of choice for Lennox-Gastaut syndrome is lamotrigine. So it is from that point of time that the scientific world understood that lamotrigine is useful for all kinds of seizures. It was subsequently tried for different kinds of seizures with great success. Now we come to the 8th question. Obsession is considered as a disorder of choice A, stream of thought, choice B, form of thought, choice C, possession of thought, and choice D, content of thought. Answer is C, possession of thought. So possession of thought means usually your thought is supposed to be under your absolute control. You are able to regulate your thoughts. Of course, some disturbing thoughts may come once in a while, but in a usual person, we can be under control. We can regulate and control our thoughts. But obsession is a repetitive, intrusive, unpleasant thought, which is intruding into your mind, even without your awareness, even without your desire. You know that that thought is false, it is baseless, but still you are unable to get it out of your system. So obsession is a disorder of possession of thought. Another example of possession of thought abnormality is thought alienation. Thought alienation means in schizophrenia, you have thought insertion. Somebody is inserting thoughts in your mind. Thought withdrawal. Somebody is taking away thoughts from your mind. Thought broadcasting. Every thought you have in your mind is known to others, even without you telling them. So these are called the thought alienation phenomena. Thought alienation phenomena are also disorders of possession of thought. So coming to stream of thought, stream means the flow of thoughts, So stream of thought abnormalities include lack of connection, something like pressure of speech, poverty of thought, etc. Form of thought, form means the structure. Form of thought abnormalities include over-inclusion, interpretation. Those things are unlikely to be asked usually for MCQs. Content of thought abnormalities may be asked as MCQs. Content means abnormal content of the thought process in your mind. So delusion. Delusion is a classical example of content of thought abnormality. Depressive thoughts, suicidal ideas, they are also disorders of content of thought. 2 more questions and we'll finish the session. 27-year-old man is presenting with sudden onset palpitations, sweating, chest pain, restlessness, and the feeling of impending doom. Physical examination and investigation does not reveal presence of any cardiac or other physical illnesses. The most probable diagnosis is choice A, pheochromocytoma, B, panic attack, C, thyrotoxicosis, 4, malingering. Answer is B, panic attack. So panic attack means intense anxiety lasting for a few minutes with symptoms like palpitation, sweating, burning sensation in the upper abdomen, blurring of vision, trembling, chilling and tingling of extremities, feeling of impending doom, or a feeling that you may fall down and die or lose your mind. So all investigations will be normal, but still that experience repeats. That is called panic attack. And if panic attacks recurrently happen over a period of at least 1 month, you call it as panic disorder. So the other choices given are all, 2 of them are medical conditions. Pheochromocytoma. Pheochromocytoma, we know it's a tumor of the adrenal medulla which secretes catecholamines. It can present with episodic headache and episodic anxiety. So pheochromocytoma, some MCQs can be asked. The clinical diagnosis of pheochromocytoma, that is by checking the blood pressure, and after that you do a firm bilateral abdominal palpation and then recheck the BP. The BP shoots up. It is probably an indicator of pheochromocytoma. Investigation of choice of pheochromocytoma is urine VMA, vanillyl mandelic acid. Then the imaging of choice in pheochromocytoma is CT abdomen. So 2 organs for which we need CT or MRI to provide evidence is pancreas and adrenal. Most of the other organs, ultrasound may be enough, but for adrenal and pancreas, you need CT, sometimes contrast and CT, and for pheochromocytoma, CT abdomen is the. And regarding the treatment of pheochromocytoma has got another interesting name. It is called the 10% tumor, because so many 10% statistics are associated with 10%. It can occur in extra-adrenal sites. 10% cases it can be bilateral. 10% of pheochromocytoma can be malignant. All those things associated. So the last question: the mode stabilizer of choice for a pregnant lady with bipolar disorder. Choice A, lithium. Choice B, sodium valproate. Choice C, carbamazepine. And choice D, lamotrigine. Answer is choice D, lamotrigine. Because lamotrigine is safe in pregnancy. Lithium can produce complications in pregnancy, including hypothyroidism for the child, and also Epstein's anomaly. Epstein's anomaly is a common adverse effect which is seen in lithium, people who take lithium. Epstein's anomaly is essentially atrialization of ventricles. Ventricles are supposed to be very muscular and tough, but the ventricle muscles will become similar to atrium. The muscularity is lost. That is Epstein's anomaly. Epstein's anomaly and hypothyroidism, they are seen in kids whose mothers have been treated with the lithium during pregnancy, especially first trimester. And both valproate and carbamazepine are notorious to produce neural tube adverse effects, including anencephaly and a whole lot of other things. They are not very safe in pregnancy. But lamotrigine, largely it is safe. So lamotrigine, we have already discussed, it is not only a mood stabilizer, it is an anti-epileptic also. It's a broad spectrum anti-epileptic. It is the drug of choice for Lennox-Gastaut syndrome, which has multiple seizure types. Safe in pregnancy also. So that is regarding mood stabilizers. So with that, I come to the end of this session.